Hello, Mr. Smith. My name is Armita, and I'm your nursing student today. How are you? So today I have a medication that I need to give you, but first, can I verify your name and date of birth? Are you allergic to anything? Great. So the medication I have for you today is called Mannitol. Have you ever taken Mannitol or heard of it? So Mannitol, also sometimes called osmotrol, is an osmotic diuretic. We can give this medication for a few different reasons, like for an acute kidney injury, since it will promote the excretion of toxins. But you are receiving this medication today, though, for your cerebral edema. That is also why we're giving it to you here in the ICU, since we can only give this medication in critical care areas. Typically, people are given this medication after a trauma, and you will see it given sometimes in the ER. So before I give you this medication, I wanted to go ahead and explain a little bit better on how this drug works to decrease intracranial pressure, which is the pressure inside your head. So your kidneys are made up of cells called nephrons, and within these nephrons is a filtration system. Included in the system is something called the glomerulus, which filters your blood. This medication will increase the osmotic pressure inside the glomerulus, which is basically increasing fluid and blood flow to your kidneys. This will move the fluid that is causing the swelling in your brain to end up being excreted. So mannitol is not indicated for peripheral edema. So we wouldn't be able to use this drug if you had fluid retention or swelling in any of your extremities, so like your arms or your legs. It is exclusively more for cerebral edema. So I wanted to inform you of some of the possible adverse effects of this medication. So this medication can cause some CNS depression, which is your central nervous system, which means we will be monitoring your heart rate and blood pressure. We will also make sure you're not experiencing any confusion or any headaches after taking this medication. And it can also maybe put you at risk for some fluid and electrolyte imbalances, since it is a diuretic, but we will closely monitor you for this as well. We also wanted to avoid using this medication with patients who have decreased kidney function. So while you're taking mannitol, we will be monitoring your urine output, as well as your BUN and creatinine on your lab work. Additionally, on that lab work, we will also check your electrolytes. We'll be checking your sodium and potassium and everything else. So something a little more interesting, though, about mannitol is that it actually can crystallize at low temperatures. So for this reason, we always store it in a warmer, since we don't want this medication to be under 94 degrees Fahrenheit. Before I give you this medication, do you have any questions for me? All right.